Hello, I'm Joni and I am a physiotherapist at OMT and I teach on the medical acupuncture courses, and today we're going to be going through a technique for the hamstrings. So we've got three hamstrings, our bicep femoris, our semimembranosus and our semitendinosus that sit on the medial side with bicep femoris on the lateral side. The things to be careful of in this area is that we have got the popliteal artery that sits behind the back of the knee. So with this technique, we'll kind of keep it in this area here, so we're sticking to muscle belly. We're not going down any lower than that. It's quite tendinous here, and then you've got your popliteal artery. You've also got your sciatic nerve, which comes from the gluteal line, and it sits a bit more laterally. It is unlikely that you will penetrate this with the needle unless you're using particularly long needles, but if you notice that the patient is experiencing any pins and needles, numbness, tingling, or pain that's running down their leg, retract the needle if that is the case. But like I said, it is unlikely, but just something to be aware of. So you want to make sure that you're having a good palpate everywhere to see where the tightness is. We have got quite a few veins on our patient here, so it's making sure that you're avoiding those. If there's a trigger point which is very close to a vein and you're not wanting to obviously go through the vein, then stick in the same dermatonal area and you'll still have a relaxation effect anyway. So have a palpate, see where it feels tight, and your needle direction is towards the femur, straight down. I've got 25mm needles here, but you could definitely use longer in this area, up to about 50mm. And as long as you're not any closer than 1 centimetre, each needle will still have a good effect. Making sure that you're only touching the handle of the needle and you're not touching the shaft of the needle at all. And then you might want to come onto the lateral side as well. It's very typical that you get lots of different parts of the hamstring that have trigger points in them and not just one side. And again, straight towards the muscle belly and towards the femur.